It's the month of October, and we're celebrating Dysautonomia Awareness. Dysautonomia is an umbrella term for a lot of different conditions that essentially sum up to your body is unable to regulate the things it should. So any unconscious system like breathing, heart rate, blood pressure, digestion, it doesn't do those right, or it's unable to do them at all. It depends on what kind of dysautonomia you have, what the cause is, how severe it is. It's a very variable condition and a blanket term for a lot of different things. Like one of the most common forms of dysautonomia is POTS, which is postural orthostatic tachycardia. That is what my doctors and both I and my doctors thought I had for a very long time, until I started pursuing a concrete diagnosis, and it was ruled out. Dysautonomia is a really misunderstood condition for both the public and also for medical personnel, because its symptoms are so variable, but it's also difficult because it is one of the most common conditions, though a lot of times it's still considered rare. It isn't, I think, and don't quote me on this, something like 200,000 people every year are diagnosed, but it takes 2 to 5 years to be diagnosed and possibly longer to find out the cause or a treatment for your dysautonomia. Because it mimics a lot of other conditions or shares symptoms with a lot of other conditions and is comorbid with a lot of other conditions, it is particularly difficult for especially uninformed medical personnel to diagnose, which means that a lot of people live with really severe symptoms and no answers for a long time. I want to share a little bit about my personal journey, my personal symptoms, and kind of my fight to get a diagnosis and where I am in that. And I hope that sharing my story will help others figure out, or at least feel more comfortable with their journey. To start, my most common symptom is high erratic heart rate, and low erratic blood pressure coinciding with each other. So my heart rate is regularly in the 90s to mid-hundreds. When I'm just sitting or standing, it rises and jumps erratically within that range or outside of that range, depending on what I'm doing or how bad the day is. My blood pressure drops when my heart rate rises, and doesn't always come back up when my heart rate lowers. My heart rate is almost never in the 70s or lower unless I'm asleep. And even within it being a high heart rate, it jumps drastically up and down. So I can jump from 90s sitting to 130 while sitting, or if I stand, it can go up to 160, 170. And what happens when your heart rate is too high and your blood pressure is too low is that usually you will get very dizzy. Occasionally you will pass out. And I do both of these things. In addition to getting dizzy and occasionally passing out, I also have a lot of muscle weakness of undetermined cause, which is a symptom of dysautonomia. So likely it's from the same root cause as the tachycardia. But thanks to both the tachycardia and the low blood pressure and the muscle weakness, I am a massive fall risk. I have fallen often. I have fallen badly. I have required stitches in my head and face. And because my condition is progressively getting worse, I have had to use a wheelchair almost full time, especially when I'm not at home. At home, I can sit on the floor if I really have to, or sit down. Sometimes at home, I still have to use the wheelchair. So it's severely limited my freedom and autonomy. Some of my less pleasant symptoms, or I actually consider them quite embarrassing, to the point that it's really hard to talk to even medical professionals about it, is I have gastrointestinal issues. Sometimes I have the floodgates open and the gut's just empty in the space of an hour or two, or the opposite happens, and and I won't have a bowel movement at all for days. I think the longest I went was almost 14 days or 2 weeks. That's really painful, by the way, and usually means that you have to stop eating. So gastric emptying and motility are issues for me. And then on top of that, I have kidney and bladder issues where I've had chronic kidney infections for years, which likely caused nerve damage to my back. So I have a lot of left side back pain and left side leg pain. As a result, most likely, of chronic kidney infections. But then I also have frequent urinating all hours of the day, sometimes 4 times a night is not unusual for me. And then there are also, I have issues completely emptying my bladder, which is not the greatest, and it feels embarrassing to talk about with anyone, even medical professionals. So even if they ask me about it, a lot of times I'll say I don't know if that's a problem for me. And if they don't ask a follow-up question when they have asked something like, do you have frequent urination? I don't know. If they don't ask me then how many times a day do I go, then they won't get an accurate picture of how I am affected. And like I said, it's embarrassing for me to think about it. It's embarrassing for me to talk about it. It's very limiting to my life. But it shouldn't be embarrassing. I'm sick. I know I'm sick. I'm disabled. I know I'm disabled. And it shouldn't be hard to talk about. I know that's internalized ableism, so I'm working on it. It's part of why I'm talking now. I want to make it more accepted to talk about the tough things, because we have to talk about it. To be able to take care of yourself, you have to be able to talk about it. So I hope this video helps someone, and continue to celebrate and fight for recognition. I would say Happy Dysautonomia Month, but it's more like happy awareness.